We lose eggs over time as we age, but what does that mean for our periods? I'm Dr. Lucky Sikon, a double board certified OBGYN and REI, and I want to talk about how we lose eggs over time and what that does to our menstrual cycles. And of course, I have to start off with this really annoying, depressing figure, and I'm sorry, but it's important to illustrate that we are born with all of the eggs that we're ever going to have, and we lose them steadily throughout our lifetime. What's shocking to a lot of people is that when we are a 20-week fetus in our mother's womb, we have the peak number of eggs, 6 to 7 million to be exact. And we don't know why, but by the time we're born, that number dwindles to 1 to 2 million. And then it decreases steadily even before puberty, before we are able to ovulate and use them. And that rate of loss tends to speed up, particularly in our mid-30s onwards, and especially after age 40, until we reach menopause, which is when we reach below a critical threshold of less than 1,000 eggs. And it's then that our cycles really stop and we go into menopause. So I want to talk about the pattern we generally see and how our ovulation and therefore our menstrual cycles and periods change as we age and as that egg count drops towards that critical threshold of less than 1,000 eggs. You don't just wake up one day and go from having a 28 to 30-day cycle to having your periods stop. There is a very gradual transition. The initial sign of reproductive aging when it comes to your egg quantity is actually the opposite of what most people assume. Your cycles actually start to become more frequent. So when patients say to me, I'm starting to get my period every 3 weeks. Now I've had a few cycles where I've gotten it every 2.5 weeks. That's a sign that they may have a dropping AMH level. And in turn, they're having a higher FSH being cranked out by their pituitary to try to get the ovaries to work harder. And that FSH leads to earlier recruitment of follicles once you start your period, and therefore you go through ovulation quicker and you get your next period quicker. And that can happen for many years. And then eventually when the levels decrease even further, that's when your cycles start to slowly then space out and become erratic, become irregular, and then eventually absent. And when you go without a period for an entire year, that by definition is menopause. For people like those with PCOS who might have started at baseline with having long irregular cycles, and maybe they typically would get a period every 35 to 60 days as an example, as they age, interestingly, their cycles also will shorten. And to them, it's going to look like, oh, I'm starting to get a more regular period. And that is something that mirrors their AMH coming down from what typically can be very high with PCOS. There tends to be a very strong association between high AMH and PCOS. It starts to kind of normalize, and they're also getting more regular cycles. And that is something we see in patients with PCOS as they get older. I always talk about the relevance of egg count being mainly surrounding the issue of stimulating the ovaries and trying to get an adequate response and how many eggs are we going to get at retrieval. But obviously, diminished ovarian reserve and, going into menopause or perimenopause where your cycles start to become erratic, if it starts affecting your ability to ovulate regularly, then yes, it can impact your fertility. But on that graph, when it said fertility decline begins in your late 30s, early 40s and beyond, that's generally speaking because of the effect of age on egg quality, not egg quantity. But egg quantity, once it's low enough that your cycles are not regular, and if you're not ovulating regularly, you're not in the game, that can impact your fertility. And that's an important distinction.